Q, B 722 together as they relate to the same subject matter. Mr. Speaker, sir, there is no specific scheme as such to provide financial or other assistance to former Prime Ministers for their medical treatment abroad. Such requests are considered on an ad hoc basis. Since 2019 to date, only one such request for assistance has been received. In fact, the request was made on 6th of September 2021 by one Mr. Daneshwar Damri for and on behalf of Dr. Navin Chandra Ramgoolam, former Prime Minister, for the government to make an advance to meet the cost of the urgent medical evacuation of Dr. Ramgoolam to Delhi by a medical air ambulance. Mr. Damri also informed that the services of a local company, the Kalua Holdings Limited, had been secured for the hiring of a medical air ambulance for the airlifting of Dr. Ramgoolam from Mauritius to Delhi. In view of the fact that the patient is a former Prime Minister and was reportedly in critical conditions, the request was acceded to and arrangements were immediately made for payment by the State Bank of Mauritius Limited through Kalua Holdings Limited for the medical evacuation exercise. The financial assistance had been extended on the clear undertaking by Mr. Damri that he would reimburse the amount so advanced. The total amount involved in the medical evacuation stands at $156,675 US dollars.
Thank you, Mr. Speaker. Can the Honourable Prime Minister inform the House whether the Labour Party has reimbursed the amount for the medical evacuation of their leader, or it was just the usual false promise?
Well, I must say, to date, the Labour Party has not yet reimbursed the amount, despite, in fact, I must say, several meetings and several reminders that have been sent.
Danu.
Thank you, Mr. Speaker, sir. Can the Honourable Prime Minister kindly inform the House of action taken to recover the amount?
Mr. Speaker, sir, in an email addressed to Mr. Damri on 28th of October 2021, he was requested to effect the reimbursement as per his undertaking by end of November 2021. A reminder was sent to Mr. Damri on 10th of December 2021 with a renewed request to reimburse the amount by 15th of December 2021. Mr. Damri still failed to effect the reimbursement. A meeting was convened on 29th of December 2021 at the Prime Minister's office, during which Mr. Damri, accompanied by Mr. Fogu, agreed to effect payment provided details of the different expenses were communicated to him by Kalua Holding Limited. Mr. Damri still did not reimburse the amount in spite of the fact that Kalua Holding Limited did subsequently provided to him all the details. A second meeting was convened by the Secretary to Cabinet and Head of Civil Service on 2nd of March 2022, during which Mr. Damri, who was again accompanied by Mr. S. Fogu, reiterated his agreement to effect the reimbursement within a week after agreeing with Kalua Holding Limited and the State Bank of Mauritius Limited on the exact amount to be refunded. Mr. Damri still failed to effect the refund to State Bank of Mauritius Limited, in spite of the fact that Kalua Limited had already submitted to him the details of the expenses incurred.
Thank you, Mr. Speaker. Can the Honorable Prime Minister confirm if the undertaking to reimburse that amount was undertaken by the Labour Party or Mr. Damri? Because as far as I know, Mr. Damri is not a member of the Labour Party.
Well, whether he is or not, what I can say is that it was not only him that had given an undertaking. In fact, I don't want to go into the numerous public statements that have been made by members of the Labour Party, namely Honorable Asia Vaden, Honorable Shakil Mohammed, and others who have publicly stated that they would be reimbursing government and that this will be done shortly, and each time it will be done shortly. But as I have replied to an earlier supplementary question, so far there has been no reimbursement.
Any further questions? So we move on to Assistant Clerk. Ministers, you may start. So I gather some people, some honourable members have withdrawn their question. The table has been advised that PQs B730, B732, B735 and B745 have been withdrawn. Honourable Deleb.
Thank you, Mr. Speaker, sir. B733.
Mr. Speaker, sir, oral health is a key indicator of overall health, well-being and quality of life. A bad oral health encompasses a range of diseases and conditions that include dental caries, periodontal disease, tooth loss, oral cancer, orodental trauma, and birth defects such as cleft lip and cleft palate. Oral lesions for certain general illness like autoimmune illness, autoimmune deficiencies and infections are frequent and help to diagnose those general illnesses. My ministry is committed to the improvement of oral health, primarily in children, through the prevention of oral diseases. In this connection, the Prime Minister has launched a 5-year National Action Plan for Oral Health 2022-2027 on 1st June 2022, with the objective of reducing the incidence and prevalence of oral diseases. The action plan is guided by the recommendations made by the World Health Organization and aims to transform the oral health services from a disease-based curative model towards a preventive model. Moreover, the formulation and implementation of this action plan and a robust surveillance system for oral diseases will reinforce towards achieving a universal health coverage. Mr. Speaker, sir, in the context of the Oral Health Month held in June 2022, my ministry has organized a promotion campaign and it has conducted the following activities: distribution of 76,000 oral health kits to all primary school students, including SEN schools, that is the special education needs schools, and ZEP schools, that is Zone d'Éducation Prioritaire schools in Mauritius, which has already started and will last for the next 6 months, and distribution also in Rodrigues will be soon organized. Oral health talks are being organized in the school by a dental surgeon and a senior dental assistant, along with proper toothbrushing techniques. and broadcasting of oral health clips to sensitize the population about the importance of good oral hygiene, and oral health talks are being conducted by dental surgeons. Mr. Speaker, sir, with regard to the measures taken for the decentralization of the dental services, I wish to inform the House that the new dental clinics have recently become operational at Bejutombo Community Health Center, Sainte Croix Community Health Center, and a second dental clinic has been opened at Goodlands. To further improve accessibility of oral health care to the population, new dental clinics will soon be set up at Stanley, Bel Air, Coromandel, and Quartier Militaire Mediclinics. In line with the budget 2022-2023, funds would be provided for the construction of 4 area health centers at Henrietta, Cap-Malheureux, New Grove, Plaine-Magnan, and 2 mediclinics, Chemin-Grenier and Grand-Bois, which will include a dental clinic. Moreover, my ministry will send a mobile dental caravan every month at Chamarel Community Health Center to provide dental services to the inhabitants as from 18th July 2022. By August 2022, most of the part-time dental clinics will be operational on a full-time basis. Thank you, Mr. Speaker.
Thank you, Mr. Speaker, sir. Can the Honourable Minister inform the House about the different services currently offered concerning oral health in the public health sector? Thank you.
Mr. Speaker, sir, the free health services in the public sector is to fully strengthen and enhance the quality of care, and it's an emphasis being placed as a patient-centered services. So the ministry offers a comprehensive oral health package, which includes the oral health promotion, that is a preventive side, the general oral health services. This includes diagnosis, extraction, temporary and permanent fillings, scaling, application of pit and fissure sealant, and specialized dental services, that is oral surgery, orthodontics, and endodontics. They are all free of users' cost.
Thank you, Mr. Speaker. Sir, can the Honourable Minister inform us about the number of dental surgeons and assistant dental surgeons currently working in the public health sector?
Mr. Speaker, sir, the number of dental surgeons in the public sector is 60. Number of dental assistants being 76, and there are, in the different regions, regional dental superintendents. That is, in the 5 regions, we have 5.
Any other question? So we move to the next item.
B734.
Mr. Speaker, sir, iron and folic acid deficiencies can lead to anemia, which has important consequences for human health and development. Anemia, even in the mild and moderate forms, can negatively impact on the quality of life of women as well as on learning capacity of the young. For pregnant women, this can lead to extreme fatigue, decrease the growth of the baby during the fetal development, and more importantly, this can lead to major risk of premature birth. Folic acid is a vitamin. Its deficiency can cause peripheral neuropathy, mental confusion, and depression. During the early stage of pregnancy, folic acid is essential for development of the brain, spinal cord, and skull. Ensuring sufficient levels of folate in women prior to conception can reduce neural tube defects. Neural tube is a basic component which will form the brain and spine in the early phase of after conception. It is estimated that around 14 children in Mauritius are born each year with neural tube defects like spina bifida due to a lack of folic acid. Zinc is an oligoelement that is important for growth, sexual maturation, and intestinal health. It also helps to support a healthy human system. The zinc deficiency is characterized by growth retardation, loss of appetite, delayed sexual maturation, and impaired immune function. Mr. Speaker, sir, in this respect, my ministry is currently carrying out a National Nutrition Survey 2022. This survey will serve the purpose of monitoring and evaluating progress made within the last decade by comparing data from the previous survey, which was carried out in 2012. This survey will also help to evaluate the prevalence of malnutrition and its related factors among the Mauritian population, especially after the COVID-19 pandemic in the country. Mr. Speaker, sir, while all micronutrients are important for physiological health, selected ones will be used as indicators of population health during the nutrition survey. Therefore, biomarkers including iron, folic acid, and zinc will be assessed in individuals during the conduct of the Nutrition Survey 2022. These selected micronutrients will provide a baseline or updated data which will allow for policy interventions. Mr. Speaker, sir, the previous nutrition survey of 2012 showed that the prevalence of anemia was highest in female aged 20 to 49 years, that is 33.6%, followed by those aged 12 to 19 years, 28.5%. In one of the previous budget speeches, this government has taken the decision to encourage the supply of brown and white wheat flour that would be fortified with iron and folic acid to address the problem of high incidence of anemia in women and reduce the prevalence of neural tube defects in newborns. In this context, Mauritius is also in the process of programming mandatory fortification of brown and white wheat flour with iron, folic acid, zinc, and vitamin B12, as wheat and wheat products are widely consumed by a large proportion of the Mauritian population. In order to set up a food fortification program relevant to our local context, my ministry has sought technical assistance from the Southern African Development Community, that is SADC. In that context, two consultants, namely Dr. Wilson Nzama and Dr. Ronald Afidra Olema from the Food Fortification Initiative, were on official visit from 13th to 20th February 2022. The aim was to meet with key stakeholders to gather information prior to undertaking a landscape analysis for planning, implementation, and monitoring of food fortification program in Mauritius. Thank you, Mr. Speaker, sir.
Honourable Jalab.
Thank you, Speaker, sir. The Honourable Minister in his reply just mentioned about a food fortification program. Can the Minister provide us with some more details?
Yes, Mr. Speaker, sir. So my ministry has sought technical assistance from the Southern African Development Community to set up the food fortification program. In the Mauritian context, wheat flour is commonly consumed food and as such the most appropriate food vehicle for inclusion in a fortification program with a per capita consumption of 241 grams per day. Rice rates second to flour with a per capita consumption of 126 grams per day. So Mauritius has only one wheat flour mill, namely Les Moulins de la Concorde, where all imported wheat grain is milled. Therefore, the setting up of a wheat flour fortification program in Mauritius will not prove to be difficult, and the focus will be on mandatory fortification. The new food regulations include a clause regarding food fortification so that the industry and other stakeholders are ready to start food fortification program by beginning of 2023.
Thank you, Mr. Speaker, sir. In his answer, in his reply, the Honourable Minister mentioned about the National Nutrition Survey 2022. Can the Honourable Minister provide further details pertaining to this subject, also the target group and the time frame for this survey? Thank you.
Yes, Mr. Speaker, sir. So the Mauritius Nutrition Survey 2022 will be conducted by the Ministry of Health in collaboration with international institutions like Monash University, Melbourne, Australia, University of Helsinki, Finland, Umeå University Hospital, Sweden, and the Imperial College, UK. So the main objective is to study food consumption patterns and assess the nutritional status of the population with a view to address diet and nutrition-related health problems and non-communicable diseases in the country. So this survey will be carried out in 16 clusters throughout the island, which have been selected randomly. The enumeration exercise has been completed in May-June this year, 2022. 2,700 participants aged between 5 years to 74 years will be invited to participate in this survey, who will be divided into the following sub-age group. So from 5 to 11 years, adolescent 12 to 19, young adults 20 to 49 years, and all adults 50 to 74 years. So the field survey activities will be carried out as from 23rd this month to 10th August 2022.
Any further question? Next question? No question? So we move to
motion.
Mr. Speaker, I move that all the business on today's order paper be exempted from the provisions of paragraph 2 of Standing Order 10.
Seconded. The question is that all the business on today's order paper be exempted from the provisions of paragraph 2 of Standing Order 10. Those who in favour say aye.
Statements by ministers.
Mr. Speaker, sir, with your permission, I wish to make a statement on the outcome of the 12th World Trade Organization Ministerial Conference held in Geneva from 12th to 17th of June 2022. The 12th WTO Ministerial Conference, the MC12, was scheduled to be held in June 2020, but had to be postponed twice due to the COVID-19 pandemic. The WTO Ministerial Conference took place in June 2022 in exceptional circumstances, underpinned by the challenges facing the world economy, in particular the escalating prices of basic commodities and foodstuff and high global inflation rate, which is a direct consequence of both the COVID-19 and the war in Ukraine. In my pre-recorded address to the plenary session of the WTO Ministerial Conference, I emphasize the impact of the above-mentioned challenges on net food importing developing countries, the NFIDCs like Mauritius, and the need for the conference to frame responses to address them. I also propose that a special desk be set up at the WTO to examine issues confronting the small island developing states, the SIDS, and to propose solutions as appropriate. Concerns raised by the developing and low-income countries regarding the inequitable access to vaccines influenced the discussions. MC12 discussed several major issues. The first outcome of MC12 is the ministerial declaration on the WTO response to the COVID-19 pandemic. The ministerial conference reaffirmed the commitment of members not to impose unnecessary barriers to trade or to disrupt supply chains, and to exercise due restraint with regard to the import of export restrictions.
The WTO was mandated to monitor and report on progress achieved in the phasing out of export prohibitions or restrictions. It was further agreed, sir, to expedite the implementation of trade facilitation measures to prevent bottlenecks at the ports, airports, and to strengthen regulatory cooperation and coherence among the member states. Second, on the issue of fisheries subsidies, after intense and protracted discussions, it was agreed that no member state should grant or maintain any subsidy to a vessel or operator engaged in illegal, unreported, or unregulated fishing or fishing-related activities in support of IUU fishing. It was further agreed not to grant or maintain subsidies for fishing or fishing-related activities regarding an overfished stock with a transitional period of 2 years for developing and least developed countries. Agreement, however, Mr. Speaker, sir, could not be reached on subsidies that contribute to overfishing and overcapacity in view of the diverging interests and positions, not only between the developed and developing countries, but also among the developing countries themselves. It was hence decided that discussions on this outstanding issue would continue with a view to reaching a comprehensive agreement on fisheries subsidies within 4 years. Should members fail to do so, the agreement reached would be terminated unless the WTO General Council agrees otherwise. Thirdly, the MC12 agreed to take concrete steps to facilitate trade and improve the functioning and long-term resilience of global markets for food, agriculture, fertilizers, and other agriculture production inputs. It was further agreed not to impose export prohibitions or restrictions in a manner inconsistent with WTO rules and to exempt foodstuffs purchased for non-commercial humanitarian purposes by the World Food Programme from any form of export prohibitions or restrictions. Members also agreed to have a dedicated work programme to consider the needs of the least developed countries and of the net food importing developing countries like Mauritius, aim at increasing their resilience in responding to acute food instability, bolstering food production, and addressing food security. Fourthly, sir, MC12 discussions also focused on a proposal by several WTO members led by India and South Africa for a temporary waiver from the WTO trade-related aspects of intellectual property rights, the TRIPS agreement to allow member states to produce vaccines that are protected by a patent. The Ministerial Conference agreed to the TRIPS waiver for a period of 5 years for the production and supplies of COVID-19 related vaccines for domestic consumption and exports. Discussions will, however, continue on the possibility of expanding the scope of the waiver to cover diagnostics and therapeutics. Fifth and lastly, sir, ministers agreed to initiate discussions aimed at reforming the WTO system so that it responds effectively to the challenges facing the world economy. It was decided that the discussions should be transparent, inclusive, and should take place under the aegis of the General Council on the basis of proposals from member states. I thank you, Mr. Speaker, sir.
Before moving to the next item,
Public bills, first reading.
public bill first reading, I would ask the Deputy Speaker to take over.
Thank you very much. Please be seated. Allow me a couple of seconds to sort out the papers before me.
Mr. Deputy Speaker, sir, I move that the Academy of Design and Innovation Bill number 11 of 2022 be read the first time.
Give me a second, please. Allow me to go through my papers.
Public bill, second reading.
Do you understand? Thank you, Mr. Deputy Speaker, sir. First, let us set the scene on this food bill before coming in the gist of our discussion. As the world population continues to grow, much more effort and innovation will be urgently needed in order to sustainably increase agricultural production, improve the global supply chain, decrease food losses and waste, and ensure that all who are suffering from hunger and malnutrition have access to nutritious food. Many in the international community believe that it is possible to eradicate hunger within the next generation and are working together to achieve this goal. The United Nations reaffirmed the right of everyone to have access to safe and nutritious food consistent with the right to adequate food and the fundamental right of everyone to be free from hunger. The Sustainable Development Goal to end hunger, achieve food security and improve nutrition and promote sustainable agriculture, SDG 2, recognize the interlinkages among supporting sustainable agriculture, empowering small farmers, promoting gender equality, ending rural poverty, ensuring healthy lifestyle, tackling climate change and other issues addressed within the set of the 17 Sustainable Development Goals. Agricultural system worldwide must become more productive and less wasteful. Sustainable agriculture practices and food system, including both production and consumption, must be pursued from a holistic and integrated perspective. Mr. Speaker, sir, Deputy Speaker, sir, land, healthy soil, water and plant genetic resources are key inputs into food production, and in their growing scarcity in many parts of the world, make it imperative to use and manage them sustainably. Boosting yield on existing agricultural lands, including restoration of degraded lands through sustainable agriculture practices, would also relieve pressure to clear forests for agricultural production. There are many elements for traditional farmer knowledge that, enriched by the latest scientific knowledge, can support productive food system through sound and sustainable soil, land, water, nutrient and pest management, and the more extensive use of organic fertilizer. In a post-Rio 20+ agenda, the objective is to seek renewed political and financial commitments for further implementation, establish new or strengthen existing partnership, and agree on priorities. An increase in integrated decision-making processes at national and regional level are needed to achieve synergies and adequately address trade-off among agriculture, water, energy, land, and climate change. Given the unprecedented situation faced by the world and climate change, the global community is called upon to increase investment in research, development, and demonstration of technologies to improve the sustainability of food system everywhere. Building resilience of local food system will be critical to averting large-scale future shortages and to ensuring food security and good nutrition for all. Coming to the bill, Mr. Deputy Speaker, sir, this is a very technical and very specialized bill, and there is no doubt that modernization and updating of our legislation in that matter was long overdue. The Food Bill 1998 can no longer cope with the emerging challenges and the new changes occurring in the field of food technology, food consumption, patterns, and quality assurance. There are issues of interest to the nation that go beyond political affinity. Food safety is one of them, as it impacts on the livelihood of every citizen. As responsible policymakers, we need to ensure that there's a proper legal framework
and business environment for dealings that concern food. And therefore, while I welcome the new food bill, I also look forward to the contribution from members of the Assembly of both sides of the House with a common aim of safeguarding our people, though that today, you know, we don't have the opposition today. Mr. Deputy Speaker, sir, recent disease outbreaks, whether it be the COVID-19, the foot and mouth diseases, or the avian flu, they all clearly demonstrate how humans can fall victims of microbial contamination. Moreover, there are also at times, unfortunately, some unscrupulous businesses who overlook food safety and tempted to market expired products. One of such cases was luckily averted in 2020 by the Public Health and Food Safety Unit when 28,310 kilograms of meat that were improper for consumption was seized. I'm therefore appreciative that the food bill is being introduced so as to reinforce our existing legislation. While the food bill depicts conditions allowing marketing of food for consumption, my appeal to food businesses is not to limit themselves to the law. I think businesses must embrace the spirit of the law and just should, by their own voluntary action, go the extra mile in ensuring that the food they provide to our citizens are safe, devoid of contaminants, whether organic or inorganic. Here, I strongly appeal that they should all have a traceability system in place so that we can identify every actor across the chain as well as every practice that the food has been subjected to. To this end, I also invite my colleague ministers to ponder on coming with a law for traceability of foods from farm to fork as far as it may be applicable, including for imports. For example, Mr. Deputy Speaker, sir, if we take an example for fresh produce, such as vegetable, many planters are victims of agricultural theft, and the culprit usually steals from place A and will come to sell it at place B. Many people will not know if this vegetable is stolen, and they will buy it sometimes at very low price, not as per the market rate. And as you are aware, Mr. Speaker, sir, Deputy Speaker, sir, we have the Small Planters Welfare Fund, which is registered for planters as per the law, and the planters have their planters card, and when we go through the food chain for fresh vegetable production, we know planters tend to sell to wholesalers like the auction market and at the regional market or to the supermarket. These can be traceable. And if we have the proper law for traceability, where the wholesaler will need to give a receipt to the planter selling to him, and then the wholesaler will sell the vegetable seller, which is usually registered with the local authorities, that is municipalities or even district council. And we also have a BIN number from the Register of Companies. As I'm saying, Mr. Deputy Speaker, sir, it is very easy to trace these products, and they will also help to combat agricultural theft. But we will need actors from each relevant ministry to play their role. Mr. Speaker, sir, we all agree on health matters. And therefore, last week, I have been very sensitive to what Honorable Joanna Béranger said, in particular, the correlation between cancer and pesticide. I am of the view that we need to have more evidence-based data among planters and consumers for us to understand what role pesticides are playing in deteriorating our health. Such studies can help us implement clear preventing policies to safeguard our citizens and maybe save millions of rupees that is engulfed in healthcare for treatment, as mentioned by the minister in his speech when he introduced the bill to the House. However, I am not on the same wavelength regarding some other claims. And Mr. Speaker, sir, Deputy Speaker, sir, I would like to shed some light on a few of them. First of all, there is a distinction between the three laws, that is the Food Act, or I should say the present food bill that we will be presenting, which will be replacing the old one, which is going to be repealed, the Dangerous Chemical Control Act 2004, the Use of Pesticides Act 2018. They all have food safety in common, but they all operate at different levels. Broadly speaking, the present food bill or the existing Food Act set the framework for the commercialization of food for consumption, whether produced locally or imported. It set a series of parameters that may deem a food commercialized to be unfit for consumption, and also a series of parameters that deem food businesses as operating illegally and therefore committing an offense. At the same time, for enforcement purposes, we have the part whereby the authority has the power to monitor food businesses' activity and to act accordingly. The Dangerous Chemical Control Act set the framework for the importation and commercialization of products that can be classified as pesticide. Here I would like to stress that there is a diversity of pesticides. This can be example for use in public health or for the agricultural sector. May I also stress on the following: an active ingredient can be perfectly legal to import by an authorized importer. However, its commercialization may be limited to a particular sector, industrial, public health, or agriculture. Thus, on occasion, the same active ingredient can be used both in the public sector and the agricultural sector, or can be banned for the use on vegetables, but acceptable for use in public health. And this is where I fail to understand how people claim that we are abusing on the use of pesticide in the agricultural sector, accusing our farmers that, I agree what we have an aging population among farmers, but they are conscious of what the planters are doing and how to use a pesticide. Mr. Speaker, Deputy Speaker, sir, if you have a look at the Digest of Agriculture from State of Mauritius regarding the section on imports of agricultural inputs, you will find that the items have been categorized into fertilizers, insecticides, fungicides, and herbicides. Regarding the use of the Pesticide Act 2018, I should say we should thank Honorable Mahen Siratan when he was Minister of Agriculture for bringing such a bill, because we should thank this government for having a vision in the future. And also, I will explain why I'm saying that. There is no indication as to whatever they have been used for food crops, ornamental, sugarcane, or turf. Could it also be the same active ingredient being used in the public health? I believe that State Mauritius should collect and present distinct data for crop protection products for food crops, ornamental, sugarcane, turf, and public health. This thus is a priority to ensure speculation on the matter, because I remember Honorable Utim saying about the consumption of pesticide and herbicides that are being overused by Mauritius. But if we will have these data, then we can have a better distinction and better understanding. It is then only then that we will know how much is being utilized by each subsector. In addition, let us also not forget that we are self-sufficient in fresh vegetables. And to achieve this, we practice an intensive crop production that leaves no fallow period in between crop cycle. Figures therefore presented in future by State Mauritius must also be correlated with food production surface area in order to understand the pesticide quantity per unit area utilized. Regarding the use of the Pesticide Act, it limits itself to the user and the use of pesticide in the food crop production sector only. It fills a void where previously anyone could apply pesticide, but with enactment of this law, only trained people having obtained a certificate, for example, from the FARE, are allowed to use or to spray pesticide. This modality looks at a critical aspect whereby people who are using pesticide are empowered, knowledgeable, and know what they are spraying, for what purpose and how this activity is to be done. This is also a preventive way to curb the abusive use of pesticide. I have to admit, though, that this is a work in progress. The law itself dates to 2018, as I said earlier. As such, if I refer to the PQB 804 in 2021, Honorable Minister Manish Gobin answered to Honorable Joanna Béranger that there were 2,088 planters trained in the use of pesticides. I'm therefore assuming that some 80% of planters are yet to be targeted, and would humbly appeal to the Honorable Minister Gobin to request to FARE to accelerate training in the use of pesticide and allocate dedicated staff if need be, as this is a top priority. Coming back to the Use of Pesticides Act, it further enlists pesticides that are allowed on crops and respective maximum residue level permissible. Now these maximum residue level are, to my understanding, from the Codex Alimentarius of the FAO. It goes, therefore, without saying that even if a crop is not listed and if tests are carried out, the same Codex recommendation will be followed. This is not explicitly mentioned, and perhaps here may I suggest a humble amendment to the food bill for the insertion of a paragraph under section 23, item 4A, whereby a food shall not be safe if maximum residue limit is outside the range recommended by the Codex Alimentarius of the FAO. This simple amendment shall cover for both local production and imports, and it provide an improved safety net for our citizens. Regarding the Guide Agricole, I should say it is a very, very good document that has been prepared. The latest one was published in 2019 by FARE when Minister Mahen Siratan was still Minister of Agriculture, and we should commend that work that has been done. Allow me to congratulate the Minister and to congratulate the people who work on this. Clearly, it's a visionary document that bridges agroecology and biofarming. Mr. Deputy Speaker, sir, as you may be aware, I have done my studies in agribusiness at bachelor level, and I have also worked for the Small Farm Planters Welfare Fund for 5 years. And thus, this gives me great pleasure to see how this document, when I went through this document, how it has been worked well for our planting community, and with the vision that we have to move the planters and the farming community to agribusinesses, and this will help forward for the vision that we have. Thus, any person feeling comfortable with agroecological practices can adopt the good agricultural practices mentioned in the book and move towards biofarming. Besides, to my understanding, it's the first time that there has been much of work and focus in recommending bioalternative for pest and disease control. Be it in terms of farming practice, use of natural enemies, use of trap plants and repellent plants, or through the use of biopesticide. This book also showcases that we have staff with talent. They should be encouraged to be the engine to transform our Mauritius agricultural sector into one based on natural farming. And if one needs inspiration, one can look at India, where there are states that have banned the use of pesticide and where crops are produced under natural farming systems, such as the new introduction in the budget, the zero budget natural farming, which and ask myself why this farming system is not picking up in Mauritius. We don't have a prohibition for it, so why? Mr. Deputy Speaker, then I realized that the success of the zero budget natural farming lies in preparation of soil enrichers or crop enactment sprays, for which they use cow urine and cow dung. And you know, this one is going to be used, it's going to enhance the production, less use of pesticide, less use of herbicide, and it is natural and less costly, which will bring down the cost of production for the planter. Even if in a rainy season, these are drained and gone to our rivers, as compared to pesticide, it also helps to grow algae and other, it is very good for the fauna and flora. It's not noxious for our fauna and flora, whether it's in the sea, in our rivers. And this is where procedure in Mauritius is flawed. In Mauritius, we are using the so-called improved breeds of cattle, which are imported, whereas in India, they use their indigenous cow breed that is bested with a unique microflora essential for the success of the zero budget natural farming, concoction using the cow urine and cow dung. I would like to encourage planters to use the ZBNF, but for this we need proper setup and raw material. So I know that this is a new budgetary measure. I know the Honorable Minister Manish Gobin and his team are working on it. So given, I would suggest, given our good diplomatic ties with the Indian government, I'm inviting the Honorable Minister Gobin to consider the importation of some of these animals and implement large commercial ZBNF plots from which our planters can be inspired from. I must also confess that several planters have contacted me and made the same request. I am confident that this can pave way to shift in our production system, which is heavily dependent on chemical inputs. Coming back to the guide agricole, it is also worth it to know that the team who work on the recommendation align themselves with the latest finding on the impact of pesticide on health, as well as conventions signed by the Republic of Mauritius. To this end, many pesticides that could be imported in Mauritius are no longer recommended. As a domino effect, the DCCB no longer delivers import permits for such products. Such products are perhaps not yet banned, but import permits are no longer issued. However, I must say that I have witnessed a disparity between the recommendation of the Guide Agricole 2019 and the use of the Pesticide Act 2018. Indeed, the Pesticide Act 2018 still lists several active ingredients that are no longer recommended in its first schedule. I take the case of Nignon, which is no longer recommended in Guide Agricole and for which import permits are no longer issued. This mismatch must be addressed and the soonest, and once more, I call upon Honorable Manish Gobin to have the first schedule of the Use of Pesticides Act updated based on the latest recommendation of the Guide Agricole. Mr. Speaker, Deputy Speaker, sir, on this free topic, I will conclude by saying that the free laws that are distinct and look upon holistically, they complement each other with the aim of ensuring food safety and food quality. I already made an appeal for the amendment to Section 23, Item 4A, which I hope shall be adopted. Allow me also to mention that there are other unseen phenomena that influence food safety and food quality that are going unnoticed. This concerns, for example, genetically modified organisms, which food, be it processed or fresh, whether for human consumption or for animal, eventually also for human consumption, consists of GMOs. On my behalf, I stand against the use of GMOs in our foods, and I shall make a request to amend the food bill so as to either prohibit the importation of GMOs food, or the Honourable Minister can make an appeal that a regulation be made to make it mandatory labeling of GM food on labels. As citizens, we have the right to know that what we are eating. As I was looking at a study in Egypt where we see the bad effects of GMOs on the health of many people there, and I see that this could be a problem for us. The setting up of the Mauritius Food Standard Agency is most welcome. As mentioned by the Minister, it will act as a body assessing and proposing food standard for adoption. It seems a bit similar to the Food Authority in Australia. I don't know if the Minister would also consider to have, I would like to propose that we'll have, like in France, a Conseil national de l'alimentation. Le CNA est une instance, le Conseil national de l'alimentation en France est une instance consultative indépendante placée auprès des ministres chargés de l'environnement, de la consommation, de la santé et de l'agriculture. Il est consulté sur la définition de la politique de l'alimentation et émet des avis à l'intention des décideurs publics et des différents acteurs de la filière alimentaire sur des sujets tels que la qualité alimentaire, l'information des consommateurs, la nutrition, la sécurité sanitaire, l'accès à l'alimentation, la prévention des crises. Il est aussi positionné comme un parlement de l'alimentation. Le CNA développe un processus de concertation intégrant des préoccupations des filières, de la société civile, la réalité du monde professionnel et attentes du consommateur ainsi en compte dans les débats. Le CNA comprend aussi les principaux acteurs de la filière alimentaire, producteurs agricoles, transformateurs et des artisans, distributeurs, les restaurateurs, associations des consommateurs, d'usage des systèmes de santé, d'étudiants, il y a aussi des étudiants, des protections de l'environnement, des protections de l'animal, d'aide alimentaire, syndicats des salariés, représentants du Parlement français, comme c'est en France, ainsi que des personnalités qualifiées, des professionnels, les établissements publics de recherche et d'évaluation scientifique aussi, ainsi que les collectivités territoriales sont également membres de droit du Sénat. Les représentants du ministère concerné assistent de plein droit aux travaux. Je pense que le Mauritius Standard Food Agency, je pense peut-être qu'on ne l'a pas créé et on va le créer. Et peut-être on pourra voir dans ce même contexte comment on peut appliquer ces recommandations-là pour qu'on puisse avoir des, comme on dit, like a food authority in Australia, et aussi comme le Conseil d'alimentation en France. Et, Mr. Deputy Speaker, sir, to end my intervention, I would like to refer to Sadhguru, who started a worldwide phenomenon with the Save Soil project. He said, let me quote, open quote, if we have any love for our children, we have to leave our soil and water in a better condition than they are now. Close quote, unquote. We therefore pledge, Mr. Deputy Speaker, sir, as a committed government to fulfill a generational responsibility for ourselves, our children, and our children's children. Thank you, Mr. Deputy Speaker, sir.
Thank you very much, Honourable Minister Siraten, please.
Merci, Monsieur le Vice-président. Monsieur le Vice-président, le grand philosophe grec Socrate avait dit, il y a quelques siècles de cela, et je cite, « Il faut manger pour vivre et non pas vivre pour manger ». Et en ce temps moderne, et avec le nouveau style de vie de la population, s'il était là, il aurait dit, il faut manger sainement pour vivre sainement. Comme vous le savez, Monsieur le Vice-président, le gouvernement met beaucoup d'accent sur la santé de la population et le budget alloué au service de la santé est énorme. Pour assurer une meilleure santé, la qualité de la nourriture qu'on met dans notre assiette et qu'on mange est aussi importante que d'autres facteurs externes. Et je dirais que la nourriture qu'on mange est peut-être la plus importante pour assurer une vie saine et par extension, diminuer le fardeau de nos services de santé. Monsieur le Vice-président, c'est justement dans cette optique que ce projet de loi, bien ficelé, bientôt renforcé. Monsieur le Vice-président, le Food Act actuel date de 1998. 24 ans après, le monde a évolué. Notre mode de consommation a changé. Le lifestyle des gens est différent. Et le manger rapide, junk food, nourriture cuite sur place, prend de l'ampleur. Et de ce fait, Monsieur le Vice-président, le public est en droit d'attendre que les aliments qu'il consomme soient sans danger et propres à la consommation et qu'on le protège des intoxications alimentaires et des maladies transmises par les aliments. Monsieur le Vice-président, la provenance de la nourriture qu'on consomme peut être d'origine végétale ou animale, produits sur terre ou des fruits de mer, des produits frais ou surgelés, des produits naturels ou transformés ou même synthétisés, des produits locaux ou importés, des produits OGM ou non OGM, des produits cuits, crus ou même pré-cuits, nourriture préparée chez soi ou de l'extérieur, des slow food ou fast food, production conventionnelle ou industrielle, et ajouter à cela, Monsieur le Vice-président, la population aussi connaît une croissance phénoménale ces dernières décennies. Et la pression sur la production alimentaire est grandissante, à tel point que la sécurité alimentaire est un sujet de haute importance pour tout gouvernement. Monsieur le Vice-président, d'après la FAO, le Food Agricultural Organization, une agence des Nations Unies, 30% de notre production alimentaire est soit perdue ou gaspillée. Et le terme très utilisé, c'est food losses and food waste. Et en grande partie de ces pertes sont dues du fait que la nourriture est impropre à la consommation et souvent par manque d'hygiène. Et en même temps, la FAO prévoit une croissance de la demande de nourriture de l'ordre de 60 à 70% d'ici 2050, avec une population qui ne cesse de s'accroître. Et pour rendre la tâche encore plus difficile, Monsieur le Vice-président, la superficie de terre allouée à l'agriculture est en baisse. Et Monsieur le Vice-président, l'OMS trouve que la nourriture impropre peut contenir des bactéries nuisibles, des virus, des parasites ou même des substances chimiques qui causent plus de 200 différents types de maladies allant de la diarrhée au cancer. Une seule bouchée de cette nourriture contaminée peut potentiellement exposer une personne à une intoxication microbiologique ou chimique. Des milliards de personnes à travers le monde est à risque et l'OMS estime que 600 millions de personnes peuvent être malades après avoir consommé la nourriture impropre qui résulte en 420 000 décès. Monsieur le Vice-président, il ne faut pas non plus oublier le scandale de riz plastique en Chine. La viande de cheval vendue comme de la viande bovine en Europe en 2013 et les faux aliments halal vendus pendant des années en Malaisie. Voilà donc, Monsieur le Vice-président, dans le souci de répondre à cette nouvelle appréhension et exigence du jour que ce projet de loi vient à point. L'objectif même de ce projet de loi le résume clairement. A new Food Act to provide, inter alia, the modernization and consolidation of the laws relating to the safety and nutritional quality of food and for matters related thereto. Monsieur le Vice-président, safety and nutritional quality. Ces mots sont à bien retenir. Ce qui veut dire écarter tout danger de contamination alimentaire et offrir des qualités nutritionnelles. Désormais, Monsieur le Vice-président, il incombe aux opérateurs de ce secteur de s'assurer que les aliments proposés sont salubres et propres à la consommation. Donc, je félicite mon collègue le ministre de la Santé et du Bien-être, l'honorable docteur Jagatpal, de venir avec ce projet de loi qui donnera plus de moyens à son ministère afin de nous assurer que la nourriture que nous consommons est saine. Et pour ne pas répéter ce que les orateurs avant moi ont déjà canvassé, je vais m'en tenir à 2 points que je trouve essentiels pour atteindre l'objectif que ce projet de loi s'est fixé. D'abord, Monsieur le Vice-président, ce projet de loi vient étendre la définition d'article. Avec l'élargissement de la définition d'article, cela va permettre aux autorités d'être beaucoup plus en mesure d'avoir le contrôle sur le produit alimentaire de A à Z. L'étiquetage et le label et la publicité vont être mieux contrôlés. Pour moi, Monsieur le Vice-président, c'est peut-être là où il y a eu beaucoup d'abus, surtout parmi les consommateurs moins avisés. Donner des informations précises et le dosage sur les étiquettes des produits de consommation permettent aux consommateurs de faire un choix judicieux du produit. Toute information erronée sur l'étiquette donnerait la possibilité à ce authorized officer de prendre des actions qui s'imposent. Mais avant tout, prendre les actions qui s'imposent, mais avant tout, Monsieur le Vice-président, la responsabilité incombe à celui ou celle qui met le produit en vente, de l'enlever du point de vente. Alors pour moi, c'est primordial aujourd'hui que les informations qui sont données sur les produits vont permettre justement à mieux comprendre le produit que l'on va consommer. Et c'est là où, pour moi, donner ce pouvoir aux officiers du ministère de la Santé de faire enlever des produits qui sont incorrects par rapport au contenu du produit, ça va aider grandement à éviter tout risque que le produit ne relève pas exactement de ce qui est dit sur l'étiquette. Et la même chose par rapport à la publicité, Monsieur le Vice-président. La publicité des produits alimentaires. Toute tentative de publicité mensongère ne serait plus permise sous cette nouvelle loi. Et on sait combien, dans le passé, il y a eu des tentatives de faire croire ou d'inciter les consommateurs à acheter ou à consommer un produit qui ne reflète pas vraiment ce qui est promis dans la publicité. Donc, pour moi, encore une fois, aujourd'hui, on est en train de donner le pouvoir aux officiers du ministère de la Santé de pouvoir agir et agir d'une manière prompte, rapide, afin de faire respecter la loi. L'autre point que je voulais aussi faire ressortir est par rapport à la section 8 de ce projet de loi, Monsieur le Vice-président. Et cela concerne justement le pouvoir donné aux ce qu'on appelle les Authorized Officers. Dorénavant, ils vont pouvoir agir avec promptitude en cas de suspicion et éviter ou réduire le risque qu'un produit soit mis en vente. Et je pense que le pouvoir est suffisamment large pour décourager tout contrevenant éventuel à prendre de tels risques. Donc déjà, ils savent que c'est leur responsabilité et au cas où ils décident de faire fi de cette loi, les officiers du ministère ont tout le pouvoir de pouvoir intervenir à n'importe quel moment et d'arrêter ou de faire enlever ces produits. Donc, je dois aussi quand même faire ressortir, Monsieur le Vice-président, dans ce projet de loi et dans un esprit pour éviter la perception d'abus ou quoi que ce soit de la part des officiers du ministère et dans un esprit de fairness, le projet de loi à la section 12 permet aussi aux producteurs, aux distributeurs et vendeurs d'avoir recours à la justice dans un délai de 7 jours s'ils sentent que les produits sont en conformité avec la législation et de reprendre possession de leurs produits. Donc c'est autant de nouvelles choses qu'aujourd'hui ce projet de loi donne comme pouvoir aux officiers du ministère de la Santé, mais aussi à tous ceux concernés dans toutes ces activités liées à la production, distribution et vente des produits alimentaires, de pouvoir faire les choses convenablement. Alors, de ce fait, je voudrais encore une fois remercier le ministère de la Santé, le ministre lui-même et tous ses officiers d'avoir travaillé ce projet de loi d'une manière très recherchée afin d'aujourd'hui répondre aux besoins du jour. Mais permettez-moi, Mr. Deputy Speaker, sir, to come back to a few points raised by some members of the opposition who intervened last week, especially Honourable Rezautim and Honourable Joanna Béranger. They expressed quite some concern with regard to the use of pesticides in Mauritius. In fact, my good friend Honourable Danu touched on this, but I would like also to say a few words on this particular issue, because it's been said time and again here itself and also outside that in Mauritius we use a big amount of pesticides, and this is causing lots of problems, health problems, and also environmental problems to the country. I mean, it is true to say that we have always been an agricultural island, and one of the main crops that we cultivate here is sugarcane, and we have been cultivating sugarcane intensively, and to protect that crop, for years we have been using pesticides and other form of fertilizers to be able to optimize the production, and of course the amount of pesticide used is quite significant. But I must say this is something which is also our concern. I mean, not only the concern of the members of the opposition, but also we, this government, we are very much concerned about this. And I must say, since 2014, when the government led by the MSM came into power, we came with a number of initiatives to at least try to address this problem. And in fact, it was said by my good friend Honourable Danu just now, but I would like also to say, because I was myself the Minister of Agro-Industry and Food Security, and I can list a number of initiatives that we took to at least sensitize, train the farmers to do away with pesticides that are very harmful to the health of to start with for themselves as farmers, but also for the consumers and also for the environment. And the soil as well, because if you overuse pesticides, it destroys the richness of the soil. So a number of initiatives was taken in terms of, like I said, sensitizing the farmers to start with, in how to protect themselves, and also in terms of to make good use of the pesticides, because if you use the right dosage and you know how to respect the time it takes when you apply the pesticide and the time that you have to do the harvesting, then if the timeline is well respected, there is no risk that there will be residues in the products that you're going to harvest and that you're going to put on the market for consumption. So a number of, like I said, a number of initiatives were taken so that these, the issue of reducing the use of pesticides are being addressed. And I must say also, we are the one that came with that idea of promoting organic farming. And we came up with a number of schemes to allow farmers to shift from conventional farming to what we call organic and biofarming. And of course, to go through that transition phase, they call it smart agriculture. And like I said, since we are trying to promote also food security in this country, so we need to produce, and to produce we have to ensure that the crops are well protected against pests, against diseases, and being a tropical island, we are faced with those risks. So we have to make sure that we have alternatives, products, to protect their crops. So that's where we also introduce and make it more affordable for farmers to have access to biofertilizers. So these are the kind of things that we have introduced to be able to counteract the issue of the problem of abusing chemical pesticides and fertilizers. And the other thing that we also did, Mr. Deputy Speaker, sir, is to create a biozone at Britannia, where to showcase to the larger farmers community how to go about and produce, to do biofarming. And we even created an organic village at Union Park. So to tell you the number of initiatives that we took in that, to that end. And of course, we introduced the Use of Pesticides Act that gave the legislation in terms of controlling further the use of pesticides, and also ensuring that the officers of the Ministry of Agro-Industry and Food Security have the power to go and to take samples on the farm and do the test. If the tests reveal that the level of residue of pesticide is above a level acceptable, then there's a kind of information notice that is issued to the farmers for them to make take corrective measures, and then to, if they repeat the same kind of act, then they will be fined according to what the legislation provides for. So that's, like I said, that these are kind of initiatives that we took to address this problem of ensuring that at least food that are being produced locally are safe and consumers are protected. And also, I must say, because I think Honorable Joanna Béranger talked about the tests that are carried out are not published. But I can see, I myself had checked on the website of the ministry all the results of the tests carried out with regard to pesticides, tests for samples that are taken by the ministry and are tested, and the results are published and posted on the website of the ministry. The latest one dates to March 2022. So she mentioned that there hasn't been any publication of those results, and they were not publicly available. So that's not correct to say that. She also asked about whether the regulatory office, whether it's functional. Of course it is. It is manned by one officer in charge and 4 other officers, and it is under the food lab technology office, and also the fund is available there. So I wanted just to give those information, because last time when they intervened, they showed some concern about pesticides. There was also one thing that they mentioned about was concerning the report of the FAO, that Mauritius is a big importer and consumer of pesticides materials. And I'm told that the Ministry of Agro-Industry and Food Security has informed the FAO that they were not comparing like with like, in the sense that they took the whole volume of pesticides that were being used here, and not comparing with other countries where they took only the active ingredients from other countries. So I believe that this is going to be amended, and probably it will give a better picture of, when compared to other countries, how much we are using. So not to be long, Mr. Speaker, sir, I just wanted to again say that this bill comes at the right time, because it's going to address the problem that we are facing with regard to food safety, and giving all the powers to the officers of the Ministry of Health to be able to do their job correctly and to ensure that we as consumers, we are getting safer food in our plate, and this is going to help for our health. It has another, it addresses also some other problem because with regard to the cost of keeping our population healthy. It has a cost to it. It has an economic cost to it. So I'm sure it's also going in line with what we want to do is to reduce the budget of the Ministry of Health. If people are healthier, this is going to mean that we're going to spend less on health care, and also in terms of productivity. I mean, if we are healthy, we're not sick, we're going to work every day, and we're going to be more productive, and that's going to help also for the economy to grow further. So let me again thank the Honourable Minister of Health and Wellness for having come forward with this bill, and I would like to wish him all the best, because I know he's been very much busy for the last 2 years in tackling the problem of COVID, and now again to show his commitment to ensure that people are healthy in this country. With this new bill, again, it shows that commitment. So again, keep on with this good job, my good friend. And with this, I conclude, Mr. Speaker. Sir, thank you so much for your attention.
Thank you, Honourable Minister. Please.
Monsieur le Vice-président, permettez-moi d'abord de vous remercier de m'avoir donné l'occasion d'élaborer sur ce projet de loi qui forcément revêt d'un grand intérêt national, car cela concerne la nutrition, notre nutrition à nous tous et notre survie aussi. Les sages disent toujours que la nature même de la nourriture est sacrée. Depuis des âges, il nous a été amène d'apprendre et de comprendre que l'alimentation nutritive et l'alimentation saine ne peuvent qu'être bénéfiques pour la santé. Cette réflexion a toujours été attribuée au célèbre médecin Hippocrate, qui se passe des présentations, bien sûr. C'est connu qu'une population pourvue d'une alimentation saine vit bien et évolue comme il se doit. I would therefore, Mr. Deputy Speaker, sir, like to commend my good friend and colleague here on my side, Honorable Dr. Kailash Jagatpal, Minister of Health and Wellness, and his officers, of course, for coming up with this bill, which I term as being avant-gardiste. Bravo, chers collègues, pour cette initiative que je qualifie de fort louable. Monsieur le Vice-président, la santé publique, nous ne le cesserons de répéter, est la priorité des priorités au sein de ce gouvernement. Responsable, bien sûr, notre Premier ministre s'évertue toujours dans le forum où il affiche sa présence de parler de la santé, de son importance globale, ainsi que de l'importance de s'assurer que toutes les mesures sont prises pour avoir une population en bonne santé. Il va sans dire qu'une population en bonne santé est bénéfique pour l'économie du pays, comme mentionné par mon collègue Siratin, là, justement, car on dépense alors moins sur les soins médicaux et la mobilisation des logistiques. Ainsi, Monsieur le Vice-président, ce food bill qui abrogera l'actuelle loi est une nécessité à plus d'un titre. Il est en soi un élargissement même de la sphère de la réglementation et du contrôle de tout ce qui a trait à l'alimentation et par extension à la santé publique dans le plus large sens du terme. Mr. Deputy Speaker, sir, I have no doubt that this piece of legislation will help to provide for more effective and efficient protection for consumers against those who put our health at risk by dealing with food that is not only unfit for human consumption but also detrimental to public health. Above all, it will allow us to cope with the emerging challenges and new changes occurring in the field of food technology, food consumption patterns and quality assurance. Mr. Deputy Speaker, sir, as already mentioned, foodborne diseases affect human health and cause significant economic loss. As we all know, food is one of the essential basic human needs. It ensures the survival of human beings by providing the most needed energy, proteins, vitamins, and other minerals subject to its inherent qualities and safety. However, the consumption of contaminated foods can cause diseases and even death. Consequently, it is essential to ensure food safety and prevent foodborne disease outbreaks among the public. Hence, the food bill comes at an opportune time when the world, including Mauritius, is confronted with unprecedented sanitary and food safety challenges, and this bill will definitely help to prevent unwholesome and adulterated food from entering the domestic market. With a view to ensuring food safety, the food bill has been aligned to the international norms and standards recommended by the Codex Alimentarius and provides for the modernization and consolidation of existing laws relating to food safety and nutritional quality. This bill is therefore intended to minimize the risk of food poisoning and intoxication due to microbial infection, poor handling practices, heavy metals, ciguatoxins, and other foodborne diseases from entering the market. In short, Mr. Deputy Speaker, sir, the food bill will act as a tool to help improve the quality and safety of food offered for sale in Mauritius through registration of all food business operators, entrusting responsibilities to the food business operator, pre-market approval, imports control, procurement of samples and laboratory testing, seizure and destruction of adulterated foods, prosecution of defaulters, amongst others. Mr. Deputy Speaker, sir, I'm glad to see that the food bill has adopted a new mechanism which is already being implemented by the European Union and the USA for ensuring food safety, where the food business operators should ensure that the food produced, processed, imported, distributed, or sold is safe for human consumption. The food business operator should also ensure that the food being sold is not prohibited or unsafe for consumption and complies with such terms and conditions as may be required by the Ministry of Health and Wellness. Moreover, the onus is on the food business operator to ensure that any food which does not comply with the law is withdrawn, recalled, and disposed of. The traceability and recall procedures will help the health authority to follow up and trace back the food supplier, the producer, the importer, and even the exporting establishment in case the food was imported, and to take appropriate measures to stop non-compliant food from entering the market, thus effectively reducing or not eliminating the risk of food poisoning and illness. Mr. Deputy Speaker, sir, the bill also provides such measures to secure compliance through an improvement notice that will give a specific time frame to the food business operator to attend to matters which constitute failure on his or her part to comply with the requirements of the law. This provision in the law will help to prevent closure of food establishments and loss of jobs, and will also guarantee the production of safe food. Comme vous le savez, Monsieur le Vice-président, l'un des secteurs dont je m'occupe, en l'occurrence la pêche, est directement lié à la nutrition et donc à la santé de la population. Les Mauriciens, tout comme les milliers de touristes qui visitent notre pays, sont très friands des produits de la mer. Il est notre devoir de s'assurer que la qualité des produits de mer locaux, importés ou exportés, sont de bonne qualité. Mr. Deputy Speaker, sir, now I would like to talk on how the food bill directly impacts on the activities related to my ministry. The competent authority for seafood under my ministry has been set up to verify and certify fish and fish products intended for export through export authorizations. They also inspect and approve fish business operators for export to our main markets, namely the EU and USA. Various biological and chemical tests are carried out on the samples before they are exported to ensure their safety as per the regulations in force in the importing countries. Additionally, the Import-Export Unit of the Fisheries Division controls and monitors the import and export of fish and fish products through permits and landing authorization at the ports of entry. The Import-Export Unit, which is based at the one-stop shop in the port area, works jointly with the Food Inspection Unit of the Ministry of Health and Wellness to ensure that firstly the fish and fish products are fit for human consumption. The consignment is accompanied by the health certificate issued by the competent authority of the exporting country. The food exporting establishment is approved and registered by the certifying authority. The fish and fish products are kept at the required temperatures. The products have been caught, handled, processed, packaged, stored, and exported in the sanitary and hygienic condition as recommended by the Codex Alimentarius, and the products comply with the microbiological norms specified in the condition for imports of fish and fish products, among others. The new measures provided in the food bill will enhance the control of both imported and exported fish to protect the health of consumers. All the consignments of fish and fish products imported into Mauritius are inspected at the ports of entry, and depending on the product, complete checks are effected at the time of unloading in the core rooms. The Fisheries Protection Service of our ministry carries out inspection at retail outlets and sale points to ensure that only good quality and safe fresh fish are entering the market for consumption. The Fisheries Training Extension Center provides training to fishmongers and fishers on fish handling, preservation and marketing with a view to empowering them to ensure production of good quality and safe fish for the Mauritians. The licenses issued to them to carry out the activities also enforce compliance with the Food Act as one of the conditions. Mr. Deputy Speaker, sir, on the whole, perishable food items such as fish and fish products require careful handling in accordance with the norms and standards recommended by the Code Alimentaire. Hence, the implementation of the food bill will no doubt ensure availability of safe and good quality food on the local market. This food bill will also provide confidence to foreigners in our export markets to procure food items, including fishery products originating from Mauritius. Monsieur le Vice-président, revoir de fond en comble les lois existantes pour les rendre plus modernes est un acte salutaire. Ce gouvernement est un gouvernement d'action, Monsieur le Vice-président. Le nombre de lois revues, revisitées à chaque fois que le MSM avec ses partenaires tiennent les rênes du pouvoir est impressionnant. Tout cela dans l'intérêt suprême de la population. Again, this food bill, Mr. Deputy Speaker, sir, aims at protecting the consumers and compelling food operators to be more attentive to what is expected and to be responsible at all costs. The development of responsible skills is much needed in the field of nutrition so that at the end of the day, consumers have the right to safe and quality foodstuff. Mr. Deputy Speaker, sir, without a proper law, comme on dit, l'emporte-pièce est la pratique courante dans la préparation des mets, dans le food processing aussi. Or, ce projet de loi vient responsabiliser les opérateurs. La sévérité de la loi est tout aussi très importante si nous voulons atteindre l'excellence. Ce gouvernement ne veut rien faire à demi-mesure. Le cadre légal, très bien travaillé, est aussi un moyen pour permettre aux consommateurs d'avoir un proper umbrella pour se protéger et d'éviter de se faire contaminer. De même, les opérateurs deviendront non seulement plus responsables, mais seront encouragés à moderniser leur business, ce qui favorisera une meilleure gestion et un meilleur contrôle. We all know, Mr. Deputy Speaker, sir, that nowadays people tend to look more for quality food than anything else and pay the price when it comes to quality of food. The World Health Organization always campaigned for the consumption of safe and quality food. Our Honorable Minister of Health and Wellness, being himself an experienced, specialized health professional, has left no stone unturned in this food bill to ensure that the population is served with food of good quality. With the food bill, it goes without saying that regulation and control are key factors in favor of consumers as a whole. In fact, all of us in the country and around the world are consumers. Yes, indeed, but we are talking about food and our lives depend on food consumption. But food does not concern exclusively consumers, but also the operators involved, either directly or indirectly, in the production, processing, or sale of food. Il n'y a pas à sortir de là, Monsieur le Vice-président. Therefore, time and again, I will say that good quality food is of utmost importance to each and everyone in our everyday life. Monsieur le Vice-président, j'ai écouté avec beaucoup d'attention et d'intérêt la présentation de ce food bill et surtout les interventions de mes collègues, mais surtout la présentation de ce food bill par celui qui sert si bien la cause de la santé, qui, avec la grande contribution de notre Premier ministre, a si bien géré, tout le monde le sait, la pandémie de notre République, l'honorable Dr Kailesh Jagatpal, et maintenant, voilà une loi pour assurer une nutrition saine pour toute la population. To conclude, I wish to quote the popular phrase, "Let food be thy medicine, and let medicine be thy food," a philosophy of fun ascribed to Hippocrates, and which has been used to emphasize the importance of nutrition to prevent or cure diseases as far back as 400 years before Christ. So with these words, Mr. Deputy Speaker, sir, I support the bill. Thank you.
Thank you very much. We shall break for 30 minutes. Thank you.